Aside, I'm actually a primary care doctor that I've been for many, many years. And this is Dave. Dave?
I'm Dave deBronkart. I blog under the name ePatient Dave, and part of how that came to be will be, sort of the end of our story here today.
So this is a story that's actually a very personal story about something that we both went through. And it's something that was so moving and personal, meaningful to us that we really wanted to share it with the world. And it's not necessarily unique. Some of you may have similar experiences. But I think it's an important lesson for our healthcare system to understand. So we'll kick off the story by talking about reconnecting and agenda setting. So Dave was actually my patient for a number of years and was interested in some of the technologies that we used in our practice. I see patients actually a couple blocks from here at Beth Israel Deaconess Medical Center. And we have an electronic medical record system. And we have a patient portal, which I think I have on here, called Patient Site. And some of you may have heard of Patient Site. Patient Site is a portal that allows patients and doctors to have secure communication. And you can look at this website on your own, patientsite.org. It also allows patients to see their record online, to get patient information, to request appointments, all kinds of stuff. Dave, when he was my patient previously, he liked it. And in fact, he sent me a note one time saying, when he first started using it, "This is too cool. It's almost silly that things can be this easy. I'm having a very good patient-customer experience so far." Go ahead, chime in.
Part of this story is that I work in high-tech marketing. I've been doing that for more than 20 years. And so as I entered, as this happens to a lot of people, as I entered the healthcare system for this big adventure, I brought with me the eyes and the listening of somebody who's accustomed to things working well and identifying where things are not working well and improving them. So one of the things I'm very attuned to is this whole issue of customer experience, which today is a big subject in the marketing blogosphere, the internet, and so on. And what was very clear to me when I first touched Patient Site 5 or 6 years ago was that this was like duh, right, compared to the other doctor's offices I dealt with where it was piles of paper. And I'm sure you're all well aware of that. But that's what's behind this, and that's a recurring theme.
It's funny, now that you said it that way, it's actually was quite refreshing always to get these comments from Dave about how things are working well or not working well or what's wrong with the healthcare system. And so it was nice to get this note from Dave. And not that we do everything perfectly, as you'll see soon. So Dave sent me a note. He moved away. He moved to Minnesota. Okay, Dave moved to Minnesota. And one day, I thought I was never going to see Dave again. One day I get this note from Dave on Patient Site, because he was still on Patient Site. And he said, "Hi, Danny, I'm Dave. Remember me? I was your patient. I'm moving back to the area, actually to New Hampshire, which is not too far away, I guess." And he said, "Can I be your patient again?" And I said, "Sure, why not?" So then something interesting happened. And this was interesting. And I want Dave to talk about this. This is kind of the note that he sent. And I'm going to just take you through this because it's interesting from my perspective and from his. He said, "Hi, well, since I'm going to be seeing you, there are several things I want to go over when we meet. I suspect several will require referrals, and given the time it takes to get a slot, I'm thinking of making those appointments now, ahead of the appointment, because you can always cancel them and create an opening for someone else. I'm 56 and generally don't have any complaints." Then Dave went through and he listed the things that he wanted to talk about in his brief amount of time that he could spend with me. Now think about that as you hear Dave's perspective on this.
So compared to a conventional doctor's appointment, this was unusual. But again, just in ordinary, everyday business life, you're going to have a meeting with somebody that you don't see very often. What do? You tell them in advance what the agenda is going to be. In my case, I sent him some links to some things that I'd found that were similar to some symptoms I'd been having. I actually sent him an image that matched an optical symptom I was having. And you compare that to just walking in and at the beginning of an encounter with a physician, you start describing all of this, right? He had the chance to let it incubate and so on. Particular things that I related were, finally, after all these years, I've been slowly losing weight. This is wonderful. My appetite is finally, now that I'm in my mid-50s, my appetite is finally settling down, which obviously is causing the weight loss. I've been getting tired earlier in the evenings, which is, That's normal for somebody who's 56 years old. One other thing I want to mention, by the way, at this moment, I went in and checked past radiology records and noticed that an X-ray I'd had in 2003 identified me as a 53-year-old woman. And that's kind of telling, because, I mean, that's a simple, innocent error, but there are other errors like that that can be spotted that can really be life-saving, literally.
So a couple of observations there. So one is that the agenda thing is really important. How many of you are doctors or have been in the past? Okay, or nurse practitioners, or nurse practitioners of some sort. Okay, so we've got a few of you in the room. It inspires fear in the hearts of a doctor when a patient comes into the office and you know you've only got 10 or 15 minutes to see them, and they whip out a list like this, and they say, okay, I got my list here for you, doctor. Now, you would think, if you're a patient sitting there, you might think this is a good thing, and it is in a lot of ways. The challenge is that if you're the doctor, you're the provider, let me just say, you have your own agenda in mind, which we don't share. It's our hidden agenda, right? Because I know that you have blood pressure. I want to check your blood pressure. I want to check your weight. I want to check your cholesterol. I want to ask you how your diabetes is going. So I have my agenda, and the patient has their agenda. And yet it's bizarre that we don't share these things and negotiate this ahead of time. Because somebody at the end of that appointment is going to be unhappy. Either it's me because I didn't get my agenda covered, or it's my patient because they didn't get their agenda covered, or we're going to stay in there 3 times as long as was scheduled, and all the other patients are going to be annoyed with us, right? So somebody's going to come away unhappy unless we can negotiate an agenda ahead of time. The other observation I want to make is the thing you just pointed out. So the fact that we've opened up Dave's record to him, so our patients can see their records online. Think about the power of that. How many of you have requested a paper medical record from a healthcare provider for you or a family member? Most of us have been through that. How easy is it to read through that? Computerized records, of course, are much easier to read. It's much easier to see things that are right, that are wrong, whatever. But it's information. It's good quality information. Dave found an innocent error in his record. But in fact, Dave has another set of eyes. I don't have those eyes. And in fact, arguably, I don't have as much stake in this whole thing as Dave does. As
arguably.
Right. So if that's true, why shouldn't Dave be the set of eyes looking for things that I may have missed, for example, right? I may not see everything. I didn't perhaps notice that you were a woman, but that was before the sex change, right? So let's move on. So Dave did make his appointments ahead of time. He made an appointment with an orthopedist. One of his problems was some shoulder pain, not an uncommon thing. And he made an appointment with an orthopedist. I examined him, saw him that day. And in the office, we used some of the technologies that we use. And Dave, as always, was marveling at how great it was. Because we're sitting there sharing the screen, right? So we can look at what's happened to his weight over time and look at his cholesterol and blood pressure. We looked at his medications and made sure that they were all correct. When I had to order a medication, I transmitted it electronically to the pharmacy, e-prescribing. And that was a new trick that Dave hadn't seen. What did you think about that?
Well, it's like, how obvious is this? You know, seriously.
We get no credit for this at all.
But seriously, EDI, electronic data interchange, in ordinary purchasing departments. This has been going on for years and years and years. How stupid is it that, well, let me get out a piece of paper and you go get in your car and drive to the place. You know, he transmits it to my specific Walgreens. They send me a text message when the prescription is ready to pick up.
Which is fabulous, by the way. Yeah, that's a neat thing. And the other thing is, of course, the system is always catching safety issues, right? So when I ordered a medication, it checked for valid doses and made sure that it wasn't going to interact with any of his other drugs. Safety, it's very important.